And did you realize that we're all probably making at least one or two of the 5 common mistakes that are happening every day in public as more and more of us are getting out and about? It's important not to let our guard down, just to be as careful as we can be. But let's talk about those mistakes so maybe we'll stop making them. Joining us right now is osteopathic medicine Dr. Tammy Penhollow to tell us what those are. Good morning to you. Thanks for being here today. So let's start with number 1. What are we doing wrong?
Good morning, Melissa. Thank you. So I see a lot of people out there wearing masks, and we've also probably seen several memes on how not to wear the mask, with the mask down on the chin or up on the top of the head, or maybe just covering the mouth. But in order to be effective, the mask needs to cover both the nose and the mouth. And then it's important, even when you put on the mask, before you put it on and after you take it off, to use a little hand hygiene yourself. You either wash your hands with soap and water or use some hand sanitizer.
Okay, when we're in public, what are we doing wrong in the restrooms?
In the restrooms, we have to think that if a surface is not clean, it's dirty. And we can pretty much assume that all those surfaces are dirty. So we want to take care and make sure that whatever we do, whatever we touch, we then wash our hands or consider it dirty until we can get to the sink. So maybe using a square of toilet paper to latch that stall, not using that hand if you haven't use the toilet paper to then touch your zipper, touch your purse, your sunglasses, anything around you. But if you use that toilet paper to latch the stall, another square of toilet paper to unlatch the stall, then get to the sink. If the sink isn't a touchless sink that allows the water to shut off once you've removed your hands from the area, continue washing your hands and dry them, and don't touch the handles with your hands. Touch them with that paper towel that you've just used to dry the hands. And then the same thing, as you're leaving the bathroom, use that paper towel to open the door. And a lot of establishments have placed the garbage can right there by the door so you don't have to touch anything.
So yeah, just those simple mistakes can make a big difference of spreading those germs. Now, what about gas stations? I was just thinking back of, I think I've only been once or twice in the last 3 months, which just blows my mind. But a lot of people are heading back to work, so they are filling their cars up more. How is that a problem?
Well, the way I look at it when I'm at a gas station is I just take a couple seconds to prepare before I even get out of the car. Do I need my entire purse? Do I need my keys and my phone and everything? And do I have my hand sanitizer ready? If I have my hand sanitizer ready, it's sitting on the console, I know the moment I get right back in the car, hand sanitizer on, and my hands are clean. So if I'm not going through the process of gloving up to touch the kiosk, to touch the nozzle, then I at least know the moment I'm in the car, before I shut the car door, before I start touching things, I can clean it. But here's another option. You just get that one point of payment out, whether that's a credit card or your phone if you're using the touchless, and you take that with you to the pump. You can hold that in your non-dominant hand, and that's your clean hand, the hand that's going to touch the gas nozzle and your car, and then the touchpad is the dirty hand, and just keep them separate. Once you get back in the car, gel off, gel right back into to get the credit card or the phone in your hands, and then everything's still clean.
Well, we just have to be so mindful, and I think that advice would probably work pretty well too when you're at any type of store, because so many places you are sharing a pen or you're doing something, you're signing that keypad where someone just touched it.
That's exactly right. Fortunately, I am seeing more stores that have hand sanitizer both on the entrance to the store and on the exit. And that kind of goes along with a lot of the thoughts we have in the medical world, where right before we enter a patient's room, it's the mantra of gel in, gel out. You clean before you go in, you clean when you come out.
All right, Dr. Penhollow, so good to talk to you today. We're out of time, but I know the last one was you just want people to be very mindful when they're eating lunch at work. Appreciate your time today. Have a good one.
Absolutely. Thank you too. Take care.